Hey, let's talk about this. For one thing, I'm suffering from a system problem. I just finished doing all 4 of these video lectures only to find out that for some unknowable reason my microphone wasn't working. So I just sat here and taped 40 minutes of lectures only to find that each one of them was utterly silent. Happy. Anyway, so let's talk about high-risk organizations and opportunities for failure, which seems like just the opportune thing to talk about right now. So let's think about this. We work in high-risk organizations as nurses. It's the way it is. There are so many opportunities for failure, it's unbelievable. Being a professor, talking to a computer shouldn't be an opportunity for failure. We won't go into that. The medical and legal system have done their level best to create the most unique environment for risk that could possibly exist in these United States or anywhere else in the world. The culture of medicine focuses on error, mistakes, screwing up, individual fallacies, individual flaws, moral shortcomings, inabilities, everything but the reality that should be focused on, and that is systems are flawed. Medical malpractice systems force people to think about the errors they could commit. There is a term, defensive medicine. We've all heard it because you have to get 1,500 different tests that have nothing to do with what you're trying to figure out, just because if you don't do it and there is something wrong, you're at fault. Avoiding error is a good thing, don't get me wrong. It is absolutely a wonderful thing to avoid error. What is not a good thing is avoiding error at the individual level by just not telling anybody about it. It's not avoidance of error, but avoidance of blame that the current malpractice system has promoted. There are those, Ranji, I think the name is, in the Youngberg text, that talks about this belief, chapter 10, this belief that certain physicians have a narcissistic need for perfection. I've worked with physicians. I've dated physicians. I have been conducting research with physicians for years. I haven't met one yet that has a narcissistic need for perfection. Some have narcissistic needs for other things. So do some of us. It's not physicians. They're human beings. It's the law that pushes them. They're complicit in creating this error-prone environment and this blame and shame culture that has become so prominent in healthcare. And yes, what you're hearing is me standing up on my soapbox. I'm sorry, it's the way I get with this. But this type of culture decreases the likelihood of finding error. It decreases the likelihood of correcting the error, and it simultaneously reinforces this belief that individual responsibility is the reason for all error, and it does not work. What ought to happen in this country to help things out, and again, me on my soapbox, but it's something that I can show you plenty of research supporting. Tort reform would help improve the transparency of healthcare. It would improve the likelihood of a systematic approach to error mitigation, and it would decrease this blame and shame environment and improve the outlook for patient safety, quality improvement, consumer quality results. And it would also remove negligence as the sole basis for fault and focus instead on enterprise liability. Enterprise liability does work. It is something that is discussed in your textbook in chapter 10, I think. And it's also something that I had the great pleasure on Friday of last week. Today is April 15th of 2012 for those of you who are watching this lecture in the future. The Friday that I just experienced was one of the best presentations, opportunities to see how error improvement can happen. I went to the Administration for Healthcare Research and Quality, AHRQ, went to their National Advisory Committee, council meeting, and I saw this professor, this physician, this incredible person, Dr. Timothy McDonald, from the University of Illinois Hospital and Health Science System, and he discussed the 7 pillars approach to liability. I posted this approach on Blackboard. There's a model that I'd really like you to pull pause my presentation for a minute and find this model. It looks like this, and it is the 7 pillars model. And in this model, they show how system liability, enterprise liability can work. The model starts at a concern or an unexpected event that gets reported to the safety or risk management team. The report can come from a patient, another healthcare consumer, a family member, a nurse, a physician, a housekeeper. Anybody who sees an opportunity for error or has witnessed error can report this. The first thing that happens is the question is asked, was a patient harmed? If the answer is no, it doesn't stop there. It goes into someone collecting sufficient data to put in a database as a near miss. These data can be collected from individuals, from the system, from whatever. And the near misses are contributory to process improvement. If there is patient harm, a different track is followed. An event investigation takes place, and that event investigation includes going to everyone involved in the error event, including the physicians, the nurses, the pharmacists, everybody, the patients, the family members, everybody. And what's really cool about this is they consider the care for the care provider. In other words, they recognize the reality that if I make a mistake, I'll feel bad. I might not be at fault for it, I might be at fault, but I'll feel bad. And because I feel bad about it, I need to have somebody to talk to help me to get through this. Just like the family member that's lost someone or has been the victim of some kind of an error. Patient communication consult services are immediately sent out to do just that, communicate with the families and the patients about what happened. While that's taking place, the error investigation, the event investigation looks at whether there was unreasonable care. If the answer is no, then they go back, they communicate with the patient, they explain, here's what happened, here's why we did what we did, this is reasonable care, we're very sorry that you feel this way about it, but this is how it's done. Now, alternatively, if the care was not reasonable or some part of reasonable care was unreasonable, like somebody was rude or somebody did something that contributed to a really bad outcome for the patient, then they go on to full disclosure, including an apology, some kind of remedy, which includes usually financial compensation. And they also include the victims of the error in a discussion about the process improvements which are planned or will take place. This guy was incredible. He presented a discussion from, or an interview, a couple of interview vignettes from a couple who lost their daughter to an error at their facility. This couple received the immediate apology, the immediate transparency, the financial compensation, and then they did something unbelievable. The man had a heart attack and came to that hospital because it was the only place he trusted. He and his wife are on the board for process improvement and have been for the several years that have taken place since their daughter died. It works well. And I have to tell you that it's definitely worth investigating. See the presentation that Dr. McDonald gave to us. I have an older version of it, but it's still the presentation. I'll catch you in another minute.